Hello, I'm Dr. Basil Bunting, psychiatrist. This lecture is relevant for all mental health workers and students, but especially psychologists, therapists, and counselors. Today I'm talking about depression. There are 5 steps for assessing depression. The first one is open questions. And open questions you ask, how do you feel? How are you? And if you don't get the proper response, you then ask closed questions, specific questions. Do you feel happy, sad, angry, or down? I use different words because I had a patient who had made a suicide attempt and was depressed. And when I asked her, was she depressed? She said no. When I asked her, was she sad? She said no. And when I asked her whether she was down, she said yes. So different people have different words, use different words to describe their depression. The second step for assessing depression is crying. I ask about crying. I ask patients, do you ever cry? Many people say they feel like crying, but they can't cry. That is still the depressed feeling. Some people deny crying. I once had a man and his wife in my rooms, and the man was depressed, and I asked him whether he cried, and he said no, he doesn't cry, he's a man. And his wife said, yes doctor, he does cry, he cries in the bathroom, so he tries to hide it. Then number 3 is safety questions. We ask about suicidal ideas, plans, intents, or attempts. We also ask about homicidal ideas because a few patients who are depressed commit family suicide, so they may have homicidal ideas. Number 4, we look at related conditions. The first one is bipolar and the second one is psychosis. Bipolar, we ask, have you ever had a period of elevated or irritable mood with increased activity and energy? Were you able to sleep during that period? And if it's yes, we ask for how long to make the diagnosis. Psychosis, you ask, have you ever heard voices when no one was talking near you? And have you ever had beliefs that other people disagreed with? Looking for delusions. Then the 5th step for assessing depression is the nonverbal assessment. This is really very important. We look at these 3 components. There's facial expression, there's body language, and tone of voice. Facial expression, you can actually see the sadness in people's eyes, in people's face, corners of the mouth are sort of turned down. And posture, you can see they have often slumped posture, and also related to body language, the movement. The movement can be very slowed, or it can even be the opposite of being slowed, where the person is like agitated. I had a medical student fetch a patient for me, and they took very long to come. And by the time he came into the room, I had made the diagnosis. This is depression with psychomotor retardation. The opposite of psychomotor retardation is your agitated depression, psychomotor agitation. The 3rd component is tone of voice. Their voice is softer, and you can actually pick up the sadness in the tone of the voice as well. So those are the 5 steps for assessing depression. If you've enjoyed this little talk, download a psychiatric interview and enroll for a free course. Both these are at my Nuts and Bolts of Psychiatry website. You can also Google Dr. Basil Bunting to get the Nuts and Bolts of Psychiatry website. Thank you.